Thank you very much first for allowing me to present this talk on personalized medicine module. So this talk is going to be a bit different because I'm going to talk about this. This is still a local pilot project, and it is quite focused on clinical application. So we have been talking several times that Spain is, I mean, it's like a mini Europe because it has a health system which has been transferred to the local autonomous governments, and we have 17 different health systems in the same country, and actually with different degrees of implementation of precision medicine or to genomic medicine. So we are in Andalusia, which is the southern part of Europe, and so we are the third largest region in Europe with 8.5 million inhabitants. So to some extent, as a region, we are bigger than several European countries. So what is interesting is that the Andalusian health system has all the population under a unique universal health record. So any patient, no matter what is him or her, can be checked or can be, the clinician can access to the electronic health record in any part of Andalusia. So Andalusia has, since 2010, I think, has an ambitious initiative to implement precision medicine in the health system. And as part of this plan, genomic medicine. So something which is interesting is that in addition to the implementation of the use of genomic data, mainly for the diagnosis of rare diseases with a system, quite similar to what Sergi has previously what they are, but with the idea of having that within the health system, with the idea of the end user should be the clinician and not the bioinformatician. Apart from this, apart from implementing this possibility, our interest is the secondary use of the genomic data in the context of this large database that we have in the health system, which is the population health database, which contains information, all the information that the health system has recorded for every patient in the last almost 20 years, and contains information on 12 million patients. What is interesting is that this information is, almost this information is structured, so it can be queried. Apart from obviously the written part of the electronic health record, but for the rest of things, analytics, diagnosis, etc., everything is structured. And the idea is that we are going to include, we are about including the genomic data of the patient, but in a structured way, not just storing the sequence, but to have the sequence indexed and in a way that can be queried with the rest of clinical data. So I cannot pass the slide. Okay. So this is an historic of the interface that we are using. That I'm not going to comment very much on that. So initially we have two different interfaces for diagnosis and another one more for research, but now we merged them. Actually, we were working in collaboration with Genomics England and with the Spanish Network of Rare Diseases. and we have this interface in which different hospitals put all the data in the context of the Spanish network of rare diseases. And actually, there is a derivation, this CSVS, which is a database in which you can find the frequencies of the alleles of in the Spanish population. We have a poster on that, so you can have a look at our poster on the CSVS. So it's a byproduct of this. And now we have moved to a more clinically oriented system, which is this personalized medicine module. So this is the acronym in Spain that we have implemented now in the health system here in Andalusia. So regarding the architecture, so we essentially put the functionality in the client. I'm part of this in the server. So we use the OpenCGA that we started to develop many years ago, and now is under development by the Genomics England. And we have, this is for the indexing of the sequences, it's an Apache Hadoop. And we have the, for the annotations, we use the cell base that we published years ago, and we are not maintaining now but we are still using it for the more common annotation that we use in the research when we do some research looking for candidate variants. And we have a different database for more specific annotation that our user requests for specific for diseases or specific or new annotation that appear that we want to test. So the idea is that, I appreciate that Sergi before has made a summary of how do people look for variants, for disease variants. So one of the things that typically happens is that if there is a not clear diagnostic variant, so the user can identify a new potential pathogenic variant and what to do. So the typical thing that one can do is to check in your collection of samples. That could be good for other diseases, but in the case of rare diseases, typically the size that you have locally is not enough. So the obvious solution would be a central repository, but because of GDPR restriction, typically, it's quite complex. So to set up that, so it's unless you are in a context of research in which you can put all the data together. If you are dealing with the data that with your patient data, you typically don't have consent for a general consent for research. It's very difficult to manage this data outside of the health system. So a different solution could be the federation, in which you can do this query, but in a clinical context. So this is, a simple use case. So you can find this variant that looks suspicious, and you can go for your other samples in your local system. But interestingly, you can also do a query in a federated network. So this is a toy federated network that we have in our place with different three installation of the software corresponding to 3 projects in which we are working now. One of them is the Navarra Genomic Project, and the other one is a project of the Spanish Network of Rare Diseases. And you can check if there are other interesting variants. So you can find several variants that are exactly the same variant that you were interested on. And that would be interesting. Only this is the possibility of discovering this variant. So that could be interesting by itself. But you can also go a little bit beyond and request access to the sample. So you can just go to the sample and request this access. So the system will contact to the owner, who may or may not grant access to the sample. So if the access is granted, you will have a notification and you can go directly to the analysis, and you can have a look at the analysis that the other group in other place has done on the sample, and you can access to this specifically to the sample, and you can have a look at the analysis done and more properties and more information on the sample, right? So this is just a proof of concept, but the interesting thing is that is quite oriented to end user, not to expert user. So all remote access is completely transparent to the user. In technical terms, the user are granted a temporal proxy token, so with limit permissions. And importantly, all accesses are logged and are auditable. And well, tokens are exchanged with standard public key cryptography and signing to ensure security. I mean, the current limitation is that we cannot mix server samples in the same query. So this is because of the architecture now, but we are going to change to allow for mixed queries. And we are now re-engineering from the ground with this completely federated access and mixed cross-server queries. Also, we will allow to make annotation cross-server, so in a way that you can contribute to information to samples that are not in your site. So we have always an eye on GA4GA's beacon specification. We are collaborating with the EGA people in the definition, in the implementation of the beacon 2.0. And we are planning, obviously, to use AAI authentication and obviously improving the user interface. So we are planning to deploy this in 4 places to check how it works across the country. That is in Galicia, Madrid, in Hospital Ramón y Cajal, in Barcelona, and BSC, and in Navarra Biomed. And this is a part of our future plans. And so something that we have to keep in mind is that we are working on health system, we are under some clinical but not research pressure. So we must keep in mind that some things are very important, like support and maintenance of this software. We need that this software is interoperable with the corporative system, which can be different in different places. We need to keep an eye on the versioning. We have to, being very aware of the firewalls. So we have to work on opening the corresponding ports to go from hospital to hospital, and also to work with certifications. So just because Andalusia has 8 million patients, so it's probably a nice testing scenario for any implementation of clinical software. So now we have set up an alliance with local software development companies and other, like Fujitsu and other, to join effort to develop open source backend for this federated management of genomic data. And I think that's all. So thank you very much for your attention.